Okay, so slightly different for this. You need one of these, Kuan. For this session, I asked beforehand Kuan and David to give me a pitch as to what they wanted to talk about, because this is a huge area, and we could sit here for the rest of the day talking about this. We've only got half an hour. I asked them each to identify issues that they thought were particularly relevant and interesting and particularly pertinent to the healthcare sector. They provided those to me, so what I'm going to do, if it's okay with you guys, is I'm going to read out some of your responses and ask you to expand on them, if that works. Yeah. Okay, so let's start then with David. Interesting statement you made. Secure data is not the same thing as well-governed data. What do you mean by that?
Right. Am I on? Yes, I am on. Good afternoon, everybody. I suppose I was reflecting on why it might be that some healthcare organisations, in fact very many healthcare organisations, have considerable antibodies to the use of cloud technology. I think it might be fair to say that many technology suppliers' reaction to those antibodies is to bang on about security in a sort of technical sense. And I suppose the point I was trying to make in this comment was that, in fact, security is only part of a suite of activities which in total add up to well-governed data. And information governance, as we all probably know, is a fairly important body of work in the NHS at the moment, and particularly important given the public exposure of risk around data. And it's not all about risk of being hacked, which security tends to resolve down to. It's a much more broader term, which is to do with ownership and responsibility. And I think many cloud providers fail to understand the set of responsibilities, indeed duties, that individuals within health services are obliged to enact, and that having good security is only part of the answer.
Okay. Kuan, this is a point actually which both of you raised, but I'll ask you to perhaps comment on it. What is cloud? Do people actually understand what it is? Is there a common definition? Are we all talking about apples and oranges rather than apples and apples?
Well, I think things are getting better in the sense that people are more familiar with cloud now than they used to be. But there are all these definitions floating around. NIST, the US NIST definition is the most commonly used. What I personally prefer, because I think it's the most easily understandable to everybody, is that cloud involves the use of IT resources over a network, scalable up and down with demand. So that IT resource could be a software application, like managing agencies. It could be raw hardware, networking, storage resources, which is IaaS, or it could be a platform for software application development and deployment, which is PaaS. So that's what I would think of as cloud. And of course, even within SaaS, there's so many different types of applications that you can have. So it's not one size fits all.
David, when your comment on this was that you found the term cloud to be problematic, and that this was perhaps mainly a marketing issue, but an important one.
Well, I suppose that comment was put forward in the context of trying to move forward the use of cloud in a health service context. And if I was a marketing guy in advising service providers, facilities providers, as to what they should call this new type of technology in order to be able to gain traction in the NHS, the word I would tell them to avoid was cloud, because clouds are floaty, nebulous things that nobody owns, that bob about with a mind of their own. No one's responsible for them. No one knows how they work or what they're going to do next. Is this the sort of idea you'd associate with you'd pitch to an information governance person? This is a nightmare scenario. So just the word is a bad place to start, really. But of course, within that, as Kuan quite rightly says, there's a set of technology stack that makes absolute sense. But there is already, because we cannot get away from the word cloud now, even though I think we should bin it if we got a slightly the first chance. I think there is an offer here, but I think it's a really hard sell in today's NHS, which is really very, very nervous about privacy and privacy protection.
Well, certainly we've heard today, time and time again, that information governance, the first word is no. Yeah. Kuan, you raised a point which I'd like you to elaborate on slightly, which is the nature of health data under existing UK data protection, or under existing data protection laws. It's a sensitive or special category data?
Yes, I mean, for all personal data, obviously data protection laws apply. But with sensitive data, what's known as special category data, like health data, then there's higher standards. For example, explicit consent may be needed. So it may be more difficult with health data, but that doesn't mean it's impossible. One way, for example, is to anonymize data for certain uses. It depends entirely on the use. Now, going back to that point about what is cloud, you have to think about exactly what do you want to use cloud for. And it can vary so much depending on exactly what you want to use it for. And the risks are different and the benefits are different. So you may or may not put personal data or health data in the cloud. Some uses, like some people were talking earlier on today, corporate data, you might not, even though it's an NHS organization putting certain data in the cloud, actually you don't have to worry about health data. So it depends entirely on what you want to use it for.
Okay, which brings us on, I guess, to, again, something which both of you raised, which is the whole question of location. We start to get into areas like Patriot Act here and offshore location. You both have views on that, so
yeah.
Perhaps we could start with David.
Yes, well, clearly, and I think my comments are really based on a presumption that we're talking about personal data relating to patients, patient data, medical records data. So I completely agree with you. There are some classes of data where where it would be perfectly reasonable and probably very uncontentious to store and use data in the cloud in the health service. But when we think about medical records particularly, I think we do need to have great care when we consider how that is. I think about your comment about anonymity is interesting, and I think up until relatively recently, I run a number of large enterprises, funded research enterprises, which reuse health services data for research purposes, and the NHS generally considered de-identification to be the same as anonymization. And the latest Caldecott report, the Dame Fiona Caldecott's report, has really rather blown that asunder. So now it is perfectly reasonable to consider de-identified data that has a degree of granularity or uniqueness in a record, can still be considered to be identifiable through reasonable efforts. And therefore, we have to be very cautious about how we imagine that any use of data which has been de-identified or not at a personal record level is handled. And so we've created in the good works of Dame Fiona actually an additional challenge for us, because even within a health service, running systems for their own reuse, there are Caldecott principles which suggest that de-identification and even perhaps anonymization should happen when those services are being run from servers in their own organization. When you start thinking about lifting those same services and putting them into a third party's hands in the cloud, in what might be a fairly nebulously described service operated by a commercial entity, they become even more difficult to explain and harder to assure. So there are some increasing tensions in how technology providers can deliver a service which satisfy those responsibilities of people in the health service.
Okay, so I think one of the, apart from the is it legal question, I think the other common theme we've had at every single one of the Think Cloud events is you're not allowed to ship public sector data overseas. Do you want to shoot that one down?
Yes. Actually, could I just comment a bit more about anonymization?
Yes, of course.
I completely agree. I didn't expand enough. It is a very tricky issue. If you can't anonymize it properly, then it is still personal data. There are some signs, at least in the past, that data protection regulators recognize. For example, key-coded pharmaceutical data might be considered anonymous enough if steps were taken so that even if theoretically somebody might just about be able to identify somebody, but on the whole it was reasonably secure from re-identification, then that might be treated as close enough anonymous or pseudonymous, which I know are slightly different things, but from that viewpoint. But for those who, I don't know whether people are aware of it, there's the UK Anonymisation Network. Do people know about this? It's partly supported by the Information Commissioner's Office, and they do offer clinics and advice on anonymisation, so where there are tricky issues there, they can be of help. On the location point, which I'll move to, I think there are two issues here. The first is, for UK public sector organisations, are you allowed to have data offshore? The second is, under data protection legislation, are you allowed to have data offshore? So the Cabinet Office issued guidance in 2011 which said that as long as there is no national security issue or some other law, like data protection law, that prevents it, actually there's no policy against moving data offshore. So basically, you have to think, does it affect national security? Is there a data protection law issue? Now, of course, with health data, which is personal data, there will be a data protection law issue. So then the question is, how do you cope with the data protection law issue regarding location? And I could probably go on for hours about the issues of location and how it's supposed to work as compared to how it actually works. But in practice, people do think of it as data center location. There's lots of metadata which could be relevant as well, but that hasn't come to the fore yet, because that is an issue as well. If data location matters, then metadata data location matters as much as actual server storage location, as much as processing operations on data location. But basically, as long as the data are kept in the European Economic Area, you're okay. If it's outside, then for US purposes, if it's kept in the US and the organization, the cloud provider, is under safe harbor, then that's okay. If it has entered into what are known as model clauses, standard contractual clauses or standard terms, which have been approved by the European Commission, then that's okay. There has been a bit of, as anywhere else, there has been uncertainty and fear about cloud. And so in one provider's case, Microsoft, which of course provides Azure cloud services, they actually went to EU regulators and got the regulators to say that their standard clauses with certain changes would be okay for most purposes, although of course you have to look at the schedule and the individual cases and the security arrangements in individual cases. And the two amendments, again, I have not seen the clauses, but from what I have heard from other sources, from people who have seen these clauses, the two amendments that Microsoft made to their standard model clauses, which made regulators happy with them, was first, Microsoft committed to deleting data within a certain period. So not data is going to be overwritten eventually when the service is terminated, etc. But within a fixed period, it would definitely be gone. And the second change was to do with use of sub-providers, which could include support staff, subcontractors, possibly even data center operators, although I don't think it's been definitely pinpointed as such in this case, but theoretically, subcontractors could be all sorts of people down the chain. And as regards sub-providers, who of course theoretically might be able to have access to data that's not encrypted, Microsoft offered the option to tell customers that yes, we are changing sub-providers, we're having new sub-providers, but you can terminate the contract if you don't like it. And those two changes to the model clauses, the regulators were happy with from a data protection viewpoint. But model clauses, they're only one way, and there's quite a few providers who offer both safe harbor and model clauses as sort of belts and braces. And there are other methods as well, but individual approval by regulators, etc. But those are the main ones.
Mention of Microsoft, we talked recently about the Microsoft test case that's going on at the moment to do. Do you want to talk a little bit about that? And does that have any direct bearing? Or is it going to set a precedent, what comes out of that?
Well, obviously, the concern is that any organization which is subject to a jurisdiction of a foreign country will say, you must give us the data that's located outside. And that, I suppose, is the thin end of the wedge, because if the US can do it, then so can other countries. And any organization which is subject to the jurisdiction of a particular country, and it doesn't even have to be incorporated there, it could just have an office there or a branch there, and then the country could say, well, if you want to run an operation in this country, we're not going to let you unless you give us the data from some other country. So, you know, it is quite difficult. That there's so many people, as you know, have weighed in on this, and I suspect it's probably going to go all the way to the top, and it'll take years. And it's difficult. I mean, my personal view is that it's actually difficult to base jurisdiction on data location, because data is much more movable than, say, a data center. So personally, I think it would be better if things moved towards the person rather than the data. But I'm not sure whether it's going to be going that way. For example, in the US, there's a possible bill which might stop that sort of thing happening unless the data is regarding a US citizen. So now that, to me, that kind of makes more sense. Whereas if the data was about an Irish person, and all the data there was about Irish people, then you can understand why Ireland would object very strongly to having data brought back from Ireland to the US.
You mentioned safe harbour a little earlier, and there's quite a few siren voices in the European Commission who don't think safe harbour is terribly safe these days. You referenced in your response to me about the Patriot Act, which you described as, I think you said, as soon as someone mentions the Patriot Act, that tends to be a hard stop on decisions that are getting made. Do you want to expand a little bit on that? I mean, is safe harbour safe? Is the Patriot Act really as scary as everybody tries to make it out to be?
Well, with the greatest respect to my lawyer colleague, I don't think it matters. Actually, because if we're talking about adoption, if we're talking about understanding what the barriers are, legal impediments are clearly a problem. And if something is illegal, nobody in their right mind in the NHS or anywhere else is going to take actions against the law. But in many cases, the issue here is perceptual. And so I might argue that many of the concerns that information governance colleagues who have been sort of thought of as being a bit of a problem thus far in this event are the genuine concerns of both clinicians and members of the public about what may or may not be acceptable. And this has little to do with the legality of what's being proposed. This is to do with what is public perception of what seems to be right. And if you were to, as I have done on numerous occasions as part of very large exercises across the UK, consult with just Joe Public, men on the street, dragged off shopping centre floors and put into rooms to talk about this stuff, and talk about the possibility that their medical records could be sequestered by the American government because it's being stored in an American-owned company, and therefore they have a right to be able to, they may have a right to be able to require that data to flow to the States. I mean, horror is a terrible. Is absolutely horrific prospect for most members of the public, and actually, given that the data that I'm talking about, at least, and much of what we're talking about today is data about you and me and everybody else in this room and the rest of the UK, it is possibly more important, or as important, to create circumstances that will increase public trust about data than it is to avoid illegality. And I think we do need to be really cautious about this and try to create circumstances where we can explain it to members of the public in simple terms, they feel that they are acceptable circumstances, and where there is greyness in the law or where there is a little bit, there's work still to be done, we have a problem. And some of the information governance responses we get from our colleagues are sort of embodiments of either that greyness or uncertainty that's currently prevailing.
And if I may add as well, of course, the concern is not just that our data could be accessed by foreign government authorities, but of course, local, UK, EU government authorities accessing our data. I think that's a global issue. It's not just foreign authorities getting our data. more people than should getting our data and sucking it up wholesale. That's a general problem. And that's not just perception, that's also reality. So how do you deal with that?
Okay, does anybody have any questions from the floor? We've got two experts on stage that you don't get access to terribly often.
Hi, it was just a question around the data residency. So you said there, as long as the data is kept in the European Union economic area, that is okay. My understanding was that HSCIC were a guidance that said English data must be stored inside of England. Does that conflict with what you said just a few minutes ago? Or am I understanding, is that wrong?
Sorry.
You were talking about the location of data.
Yeah.
And you said as long as the data is located within within the EU,
Yes.
that should be okay.
Yes, under data protection laws.
But with the HSCIC, I guess my understanding was that they said English data for English
Only.
patients must only be stored inside of England. So
Is that a recommendation or is that a rule on from their viewpoint?
I don't know. That's what I'm kind of
Yeah.
asking.
Yeah,
Well,
no.
could I make a contribution? Because I think this is really quite a good example of where the law is, most law is not permissive. Most law tells you what you can't do. And discretion then reigns what you want to do. And so in this case, it's a mixture of, it's an organisational policy to make a statement that the data must remain in England. But that's not a requirement of law, as far as I understand it. That's this is a decision that they have made, which obviously I'm based in Wales, so it excludes the data coming to Wales, for example. Although, I suspect they may well find that in the interest of the United Kingdom, they may well relax that position at some point in time. But it's a good example of where we need to be should be defined on what we need to do in order to be able to get where we want to go. And the law should support that. And but the parameters are set by what's legal, and then what actually happens is at the discretion of real people making real decisions within organisations. And in this case, that was the decision they made.
Just like the Cabinet Office's guidance is different. And of course, a lot of it is, I suppose it does reflect a general perception that, oh, if it's in the UK, then it's going to be safer. There have been so many surveys where businesses have said, oh, yeah, I just prefer to have my data in the UK. But actually, personally, I think it's not the location that matters as the security. If you have data in an insecure server in the UK, then that's much more at risk than having it very well encrypted in a server in the US. So to me, it actually, the emphasis ought to be on security rather than location. But that's not what the law is, as it's been interpreted, at least by various regulators and people who can provide policy guidelines or recommendations.
A lot of this is down to interpretation, isn't it, and perception. I mean, there were a couple of very large US cloud providers who have data centres in Scotland who were waiting very nervously on the day of the referendum to discover whether they were suddenly outside the European Union. But that would have been utterly ridiculous, presumably. Yeah. Anybody else? 1, 2, 3. Okay.
Sorry, really, I just wanted to support what Professor Ford said about the perception thing being important. Monitor uses lots of secondary use data, as do lots of research people. And if we don't get the perception and the actuality that actually that data is safe, then we won't be able to do our jobs properly. And in our case, it will be looking at the effects of changes to local health economies. For clinical research, it could be for other things. And so I think we really need to be out there promoting the fact that we want this data, we want it for legitimate purposes, and we want to keep it safe. And we are not interested, certainly in Monitor, in identifying individuals or having patient identifiable data. But we do need a degree of detailed information about people in areas so we can make sure that the services that are being planned for those areas, or if there's going to be a change to the way services are configured, meet the needs of the patients. So I think there's a whole thing about cloud, and I come from an IG background, but I think it doesn't really matter where it's stored. It's all about what controls are in place and how you use that data. But we do need to be reassuring everyone that we are making the proper use of this data and it's for the legitimate purposes which people would accept. And I think we need to publicise that more.
Transparency obviously is going to be very important there, as to exactly what you're doing and how.
I'm Jane Dunnage. I'm a trustee for Lupus UK as well for National Voices. And we've just been given funding for a very big research study into lupus, which is quite an unusual illness. But we will be using big data, and we're working in collaboration with a number of patients. So that's partly why I've come today, partly wondering whether we have standards of care on a lot of clinical matters, and I'm just wondering whether this might be a beginning to have a standards of care of what the data is used for, so the transparency is clear to the people who are representing the patient, if you like. But I'd be interested to know how far this has gone in other areas.
Well, could I make a comment? I think you're absolutely right. I mean, if we are thinking about data and personal medical records, there is a massive amount that could be done with that data for the benefit of the patients individually, the classes of groups of patients who suffer from similar conditions, and from the health service at large and society generally, and a very small fraction of that is being done right now. So largely the data that we are talking about is locked away in silos under lock and key, often sometimes physically, very hard to get hold of, extremely difficult to reuse. The sort of nirvana that we heard about this morning is fantastic, but I find a big gap between the political rhetoric and the bottom-up approach about individual data and how it gets to reuse. And the idea that somehow an individual is going to be able to consent to the multiplicity of uses that data could have is really quite difficult to imagine, actually. My experience of working with members of the public is that they have, they're like me. They have opinions, but those opinions are changeable, and they're very contextual. So you can describe a use of that data, to say, to create a better circumstances for patients with lupus, and you can describe how that might be done safely, and they will go, absolutely, yes, of course, well, you must do that. But you can describe something very similar that's somehow qualitatively different, and they'll say, no, over my dead body. And actually, all of these conversations we're having, it's not about the technology, really, in my view. It's the technical solutions are there to a very large extent, parking some on forthcoming European regulations, which might make it all rather difficult. But largely, there is permissive legal circumstances. There's technology solutions. What is not understood is what is acceptable. What is really will people tolerate? What will people support? And what will people not support? So, for example, in my work, we have found quite clearly that some industry sectors are poisonous to the point for people, members of the public. The one that pops up most conspicuously is the insurance industry. So most people consulted will say, over my dead body, will my data get passed to an insurer to make decisions about how to set premiums and thresholds and such like. And the next industry sector that's a bit more questionable is pharmaceutical industries. And sometimes they say yes, new drug discovery. That sounds great. Massive projects, profits on the back of drug discovery. No, they shouldn't have my data. Improving the NHS usually answers yes, but then it depends. Lots of it depends. So the complexity of this problem, I don't believe, is because there's a deficiency in the technology or in the legal situation. That we don't really, as a society, understand what our individual preferences are with reuse of our data, and what the circumstances should be for it to be safely and properly governed. And we haven't, as a collective, the UK has not really resolved that problem yet.
And also, of course, that can be cultural. So.
Okay, I think we have a follow-up here and then 2 questions over here. Are you sure? Okay. Okay, that one's been answered, so over here.
Thank you. Some very interesting discussions going on here, particularly like your last comment about cultural aspects as well. Putting aside my profession as a scientist, I'm also a vice chair and acting chair for an NHS Research Ethics Committee in neurology in Queen Square. And we have quite a lot of principal investigators who we have to advise them. Sometimes they want to use the data afterwards, that they've got tissue data or other kinds of data. And we advise them to ask the participants to gift their donations of whether it be tissue or whatever. And what I'm curious about is that if this is a gift they've donated, that means that it might not be accessed until maybe 10, 20 years later. And I'm wondering if there's any kind of way in which different technology has been used to kind of store it up there, if they'll be able to speak to each other. Because obviously if you're saying, yes, you can use it, you can use my blood or my cells 20 years later, there is the possibility that the way that it's been stored then might be different and it might come under different kinds of clinical governance. I don't know what you think about that.
Well, I could make an observation on your point. I think, sorry, it sounds like a bit of a sidetrack, but it's not. I don't know if you remember when what is now Genomics England, the 100,000 genetics project was launched. Does everybody remember that? They did the bravest thing I've ever seen anybody, organisation ever to do, which is they said at the outset that they were going to effectively do 100,000 whole genetic scans of volunteers, and they were going to put those genomes on the internet, and anybody from anywhere in the world could download them. And part of the accompanying media conversation that occurred was that people from Genomics England were going and saying, and the consequence of this is that, in theory, a criminal in some other part of the world could synthesize your DNA and plant it at a crime scene, and you would, for all intents and purposes, be incriminated in that crime because your genetic material will have been at that site. So then they rehearsed, and they rehearsed a series of these disaster scenarios. Another one being some scientist in the near future could create a clone of you, and that clone could be walking around the Earth because they had the full genome. It can't be done now, but it could be in the future. So this kind of idea that somehow a donation now could lead, there's an unknown future, what that donation could be used for, is real. And the consequence of what there was this terribly brave thing where they were going to publish all of this data and make it freely available, and the consultation that accompanies the position right now is that it's all going to be locked away and no one can gain access to this genetic data. So it will exist and it will be stored, but it will be under very closely supervised circumstances. So they reversed right back from what they hoped would be an acceptable position about storing genetic material and the accompanying genome for the future prosperity and letting the world dive in, to we've got to keep this, even though they're consented people that have agreed to the terms and conditions, they're actually going to lock it away and govern it very closely. So I think there is a difference between aspiration and reality. When it comes to the crunch, people want a little bit of reassurance that their privacy is going to be respected now and in the future.